Becky, if you would, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg. Senator Carroll.
Here.
Senator Elkins. Senator Funky Fromeyer. Senator Nemes.
Present.
Senator Tishner. Senator Wise. Vice Chair Douglas.
Present.
Chairman Meredith.
Present. So know we do have a quorum and duly constituted to conduct business. First thing I would mention is we do have an overflow room in 149, if anyone would like to take advantage of that. And part of the reason we have such a large group present today is I'd like to introduce a great group of young people. This is part of the cooperative outreach for Kentucky Electric Cooperative, and we have numerous high school juniors who are attending this morning as part of their youth tour program to tour the Capitol, engage with the legislature. So, young folks, if you would, please stand up and let us welcome you to our Senate Services Committee meeting. Glad to have you this morning. We're going to have a little bit of change in our agenda. We're going to start with Senate Bill 71, and that's Senator Philip Wheeler is present, and glad to have you this morning. If you would, you know the routine, please introduce yourself for the record and proceed.
Thank you, Mr. Chairman. Senator Philip Wheeler, 31st Senate District. Senate Bill 71 is a proactive bill to correct some mistreatment of folks who are sick and have addiction problems that are attending certain rehabilitation facilities and rehabilitation housing across the state. When they leave the facility voluntarily, sometimes they're just getting put out on the street with nowhere to go in a county or a city 200 or 300 miles away from where they live. This merely states that these places that are receiving, large amounts of government dollars through Medicaid services, that they provide transportation back to their a specific address or the city hall in their town of residence. We've seen instances throughout the Commonwealth of Kentucky where some of these facilities that are less reputable are simply dumping these people on the street. A lot of times that causes criminality and other type of behavior because these people just have nowhere to go. It's overloading the homeless shelters and the social services. And this merely says that this gets them back to a place that they're familiar with, and make sure that these facilities aren't just creating more problems than they're solving. That's essentially the bill. I don't know if anybody has any questions. I'll be happy to answer them. I think it passed out of this was previously filed by Senator Higdon. I think it passed out of the Senate nearly unanimously last year. That does have some tweaks that were recommended by the AOC, some recovery organizations, and other folks in the addiction community. I think the warrant search was in the original bill. Oh, and I guess I should probably say you all have a committee substitute. I don't know if that needs to be adopted real quick, since I have been addressing my comments towards the sub.
Motion on the sub. Is there a second?
Second.
All in favor, vote aye.
Aye.
All right, thank you. Your sub is adopted. Thank
Okay,
you.
but essentially the sub was just cleaned up a few things. I think the AOC expressed some issues, as well as some addiction providers with HIPAA compliance. The Hospital Association had some concern that they might be caught up in this, so we did narrow it to make sure that it was simply addiction treatment providers and the providers of recovery housing. So it's a little tighter bill, but I think actually a better bill.
Sorry, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Aye. Senate Bill 27 is amended by Committee Substitute 1. Passes with favorable expression. So congratulations, Senator Wheeler.
Thank you, Mr. Chairman, and I appreciate the committee's time.
We do have a title amendment on this, so we need a motion on the title amendment as well. Motion, is there a second? Second. All in favor say aye.
Aye.
Motion carries. Chair, and turn this over to Senator Douglas, Co-Chair Douglas.
Oh, boy.
Before you get started, if you want to recognize Senator Wise to cast a vote on the first bill, just ask Senator Wise if he'd like to do it. 71.
Good morning, everyone. Before we get started with this, I'd like to, Senator Wise, would you like to cast a vote on Senate Bill 71?
Absolutely. My apologies for my delay. I cast an aye vote on Senate Bill 71.
So let it be recorded. Thank you very much. Again, I want to say good morning, and it really is wonderful to see all the young faces out there. Believe it or not, those of us sitting up here once had young faces. So we appreciate seeing you all. Before we get started with this bill, we do have a proposed Senate substitute, 1 to Senate Bill 27. So is there a motion to adopt the substitute? Motion by Senator Elkins. Who's second? Second by Senator Tishner. All those in favor, please say aye. Aye. All those opposed? Substitute is adopted. Now, I'd like to, I'm going to ask our presenter, Senator Meredith, to introduce himself, and if you will, please explain the bill and do what you need to do.
Thank you, Co-Chair Douglas. I'm Steve Meredith. I'm State Senator for the 5th District of Kentucky, here to speak on Senate Bill 27. Not going to regurgitate everything that you folks heard last week when we had discussion on this bill. Don't see the necessity for doing that, but would like to talk briefly about 340B itself, because it seems to be some kind of a mystery program, and it's really not. It was started in 1992 during the George Bush administration as a means to provide financial resources to our most financially distressed hospitals. And it worked very successfully during its inception. It did change radically in 2010 with the Obama administration, where they expanded the definition of covered entities. Originally it was for safety net hospitals, but included rural health clinics, fairly qualified health clinics, various and sundry other clinics that are providing service to the poor, and there's 10. If you look at the definition of what a qualified entity is, and it identifies notably hospitals that are providing services to disproportionately shared hospitals. That meaning that a high percentage of Medicaid patients, a high percentage of poverty patients. And the intent was to use the resources from the discounts from pharmaceutical drugs. And I will acknowledge that in 1992, this was agreed to by the pharmaceutical manufacturers to give these steep discounts to these necessary providers and use those for very vital services, possibly drug discounts to the poor, but also to fund services from daily operation for some facilities and others that can expand the scope of their service, such as cancer clinics. So it is a valuable resource to those providers who are qualified. Also in 2010, the Obama administration also changed the parameters of the bill. Originally, qualified health providers could use one pharmacy manager for this, prescription drug manager, not prescription drug manager, but pharmacist, covered pharmacist. And they broadened it to say you can have as many contracts as you want with these contract pharmacists. And as a result of those two measures, the program has exploded significantly. And I can understand the angst of the pharmaceutical industry. It is big numbers we're talking about, but I think it's interesting that last year, 2023, for the top 5 drug manufacturers in the United States, that their gross revenue was in excess of $325 billion, with a net income of $89 billion. 340B only represents 7% of the prescription drugs in the United States. You know that our pharmaceutical managers, our pharmaceutical manufacturers have international markets. So really, when you look at their total book of business, this is a small percentage of their business. What has occurred, as noted last week, is that they have decided rather arbitrarily that they were not going to honor these 340B discounts to covered entities. Again, most notably, 78% of these covered entities are hospitals, many of them critical access hospitals. In my particular district, I've got 3 hospitals, small hospitals, and the cuts have been substantial. For one facility, it was $700,000. For another, it's $1.3 million. For another, it's $1.6 million. And these are funds they're using for the operation of outreach clinics, but also for day-to-day covered expenses. I will acknowledge that the 340B program has a multitude of problems which have been generated over the past couple of decades, but it's not our role to fix that. It's a federal program. It's not the role of the manufacturers to fix this. Our bill, quite simply, and I'll point you to Section 2 of the bill, that says that manufacturers shall not discriminate or cause others to discriminate against 340B covered entities by refusing or withholding 340B pricing for a covered drug if the manufacturer offers the same drug at the 340B price in any other state. Quite simply, we don't think Kentucky be discriminated against. I gave you the revenue loss from just 3 small hospitals in Kentucky, but you multiply that by the 100 or so that we have in the state of Kentucky, it's going to cost us billions of dollars that really the cuts are not warranted. All we're asking for is to be treated fairly as they treat other states. And that's the essence of the bill. Mr. Chair, I entertain any questions.
Thank you, Senator Meredith. Do we have any questions?
Motion on the bill.
I hear a motion on the bill. Do I hear a second? Secretary, please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Berg,
I explain my vote.
Go ahead.
I want to thank you very much, sir, for bringing this legislation. I think there's 3 pieces of legislation in the healthcare field that are extremely important this session. This is one of them. And I agree, this is not a problem that we as a state should be addressing. This should be addressed on a federal level. It has not been, and we have no choice at this point but to step in and manage it more locally. Thank you.
Thank you, Senator Berg. Secretary?
Senator Carroll,
Aye.
Senator Douglas,
Aye.
Senator Elkins, Senator Funky Fromeyer,
I'd like to cast my vote, but explain.
Explain.
I'm going to vote yes, but I'm very alarmed that we're not at the root cause of the problem. And as you've stated, it's perhaps a federal solution, but the alarming rate of the increase of these drugs being used, it's quite alarming. And when I often talk about the wellness revolution, I don't understand, and yet I'm still voting yes. I just don't understand the exorbitant use that appears to be a conversion to maintenance versus healing the acute event and really getting people back to a healthy lifestyle and pursuing lifestyle changes. Just the use of the drugs is absolutely exorbitant from what was shared with us in the last testimony. So I just pray that our hospitals and our health community is working to resolve the health events, not the dependence on these medicines for lifestyle.
Senator Nemes, Senator Tishner, Senator Wise,
Aye.
Chairman Meredith.
As Cass and I vote, would like to explain my vote.
Explain, please.
I agree completely with Senator Funky Fromeyer. And I think if you look at what we're facing with healthcare, and you folks have heard me talk about this before, the increase not just in prescription bugs, but healthcare in total is quite alarming. It's pushing close to 20% of our gross national product, and we cannot continue to sustain it. I think one of the biggest challenges, Senator, is the corporatization of healthcare, that it's become a profit center for so many, and we need to be in the mission of providing health care to people. And I define that as healing the sick, relieving pain and suffering, improving the quality of life of people that we serve. And I think we have drifted away from that, we being the healthcare industry, and we need to get back on point. If not, it's going to be a true economic crisis for our nation and result in another healthcare crisis. But again, aye. Thank you.
Thank you, Senator Meredith. The vote is 10-0. Senate Bill 27, as amended by Committee Substitute 1, passes with favorable expression. Now, we do have a title amendment. Is there a motion to adopt a title amendment? Motion? Second. Thank you. All in favor, please say aye. Aye. All opposed? Title amendment is adopted. I'd like to recognize Senator Berg and ask her if she'd like to cast a vote on Senate Bill 71. So be recorded. Thank you very much. Is there anything else that needs to be brought in front of our committee today? If not, I want to thank all of you all in the audience who have participated, and I really want to thank all of you all the senators on the committee for participating. The next Health Services meeting will be on Wednesday, February 27th at 9 o'clock, and I hope you all will join us there. With that being said, this committee is adjourned. I like it.
You like that?
It's all right.
I remember that from this room. I had to do that. I did walk in on another meeting.
Oh man, it's 18 after. What do we do?
Nice quick meeting.
Man, you the man. Congratulations.
I lost my notes.
Did you?
Guess they're up my